Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us again. Going to be speaking with Abby Westerman, Astellas Oncology's 2019 C3 Prize Emerging Ideas winner. And she's joining us to talk about the mission of the foundation that she founded. That's a social support network for young adults with cancer. Welcome to Health Professional Radio, Abby Westerman.
Hi, Neil. Thank you so much for having me. I really am honored to be able to share our story with your listeners.
A bit of your background. What is it that you do? What were you doing before applying for the prize? And what is it that you're doing now?
So actually, I was an engineer for 33 years. And during that time is when my daughter was diagnosed with cancer. Mm-hmm. And I basically took a different direction after the lessons learned from that experience and founded Be Present Foundation, which is the organization that we're currently running, and that is the organization where we submitted the C3 Prize submission to.
Now, this Astellas Oncology C3 Prize, it's a prize that's awarded for any type of idea to help cancer patients that goes above and beyond just the medicine, right?
That's correct. Yeah, the C3 Prize, C3 is for changing cancer care, and it's actually quite an incredible opportunity that they are providing to those of us in the community that have gone through an experience that was life-changing and really giving us a chance to make a difference for something that was an obstacle for us and probably an obstacle for others as well.
You know, you say you learned some lessons going through your own experience with cancer. Talk about some of those lessons. Were those lessons the incubus of your foundation, the Be Present Foundation?
Yes, they were, absolutely. So my daughter, Kirsten, was diagnosed with leukemia when she was 19 years old. So she was a young adult just getting ready to start her life. And really the social support network is vital to that age group just in general. But when you're a young adult and you're going through the cancer experience, especially when you're limited to the four walls of the hospital room, it really becomes a challenge for that social network to continue to support. And that was really her experience. I think her friends really wanted to be there for her, but many of them, struggled with what to do or what to say. Mm-hmm. And so really the commitment and founding of the organization was to help the young adult with cancer by providing the tools and information to that young adult support community so they are empowered to be present.
When you say empowered to be present, having skills or knowing how to bring up certain conversations or not feel apprehensive about talking about certain things because your daughter had cancer?
Yeah, so it's kind of an interesting phenomenon. When somebody has the label cancer on them, mm-hmm. It's just interesting how people start to treat that person differently. Mm-hmm. They haven't changed at all, but suddenly the conversation becomes awkward. They're very limited or reserved with what they say or how they act. They just, I think for a lot of young adults, it's the first time they've ever heard the word cancer, let alone have it be something that's placed on the friend that they've been hanging out with. So really what we're trying to do is provide the tools, provide the information, give them the confidence to know that just being in the room has impact. It can change quality of life and improve health outcomes. And really, all along the way to help them navigate that process, which can be intimidating, I think, for a lot of young adults.
Did your daughter, you talk about some of the awkward conversations. Being sick has a type of a stigma all its own, but there are certain illnesses that have different types of stigmas. Did your daughter come to you and say, hey, this is happening, that is happening, and were those some of the things that you decided to address in your foundation's mission statement?
Well, I think she, so we were in the hospital with her basically every day. And so we saw with our own eyes what she was going through. But mm-hmm. Again, as a young adult, they are just starting to become independent. And so the last thing they want to do is start to become dependent on people. So I think she probably kept inside her a lot of maybe the things that she was feeling. But I could certainly see visible from body language, the isolation she was feeling. I mean, she got her energy from her friends. And so to not be around the people that she wanted to be and to feel connected to the outside world was really difficult for her. And I think really put a strain on her motivation, I think, sometimes to proceed. And I think it also just really impacted her recovery times, too, in between different treatments. So it was visible to me that there was an impact, and so she was actually a very vocal advocate within the hospital for making change, for making people accessible, for being able to reach out and meet others in the hospital setting, as well as to educate her friends. So her vision is really what we are carrying forward. It is 100% the things that she wanted to do. Unfortunately, she didn't make it. She passed away 7 months after her diagnosis. So we're really just carrying the torch for what she set out to begin with.
How has your foundation evolved since winning last year in light of the current COVID-19 pandemic?
Yeah, so it's interesting you bring that up, because I was actually reflecting that I think that this would have been even a harder time for her if COVID was part of the formula. And I have heard that time and again, that COVID is making an already complex cancer care situation even more complex. And so for us, who would have thought that winning the prize, 9 months later, here we are with a completely different view of the world. And what we really tried to do with our prize winning idea, which was the Be There tool, which is basically a connection tool for patients and supporters to stay connected and to make the communication easy between, asking for help and offering that support. And so really what we did is we pivoted as an organization and felt it was important to provide that tool online in a beta version earlier, to really provide that assistance to others in the community that potentially could use it for their experience with COVID. Because the common denominator is isolation, and whether you have cancer or whether you're a community that's at risk and is isolated, that this is really a means to help the supporters out there understand how to connect and how to provide the support that's meaningful on a particular day.
Now, Astellas Oncology's fifth annual C3 prize has launched, and applications are being accepted now through September the 28th. What would you say to the applicants who are seeking to get their idea considered?
Well, first of all, I would say that the Astellas C3 prize has been just a fantastic experience and a life-changing, game-changing experience for our organization. And our story is all about an idea that was moved forward and empowered by the C3 prize. And so I would say anybody that has been impacted or experienced a challenge with cancer care and thinks that they have an idea that they can fix that particular challenge, I would say absolutely bring it forward. Astellas C3 prize is a fantastic opportunity to move that idea forward and really get it into the next level where patients, supporters, those that are impacted by cancer can really start to see an improvement in their cancer care.
Abby, I appreciate you joining us here on the program this evening.
Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Abby Westerman, founder of the Be Present Foundation. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/healthprofessionalradio.